Hi. In this lecture, we're going to cover some drugs for glaucoma. Now, glaucoma, is the condition where there is of the eye, where there is increase in the intraocular tension. So the intraocular pressure increases, and it can be because of any of the reasons. Because you know that in the eye there is production of aqueous humor by the ciliary body, and वो aqueous humor then drains out through the trabecular meshwork. By any reason, if that outflow, ये जो path है, it is blocked, so that aqueous humor, that fluid is not able to go out. So that fluid is going to accumulate in the eye, and eye is going to be swollen and it's going to be painful because nerves all around है. उसको press करेगा, it's going to be a lot of pain. And अगर treatment नहीं दिया गया immediately, in certain cases of emergency cases, person can even go blind. So it becomes imperative to treat the glaucoma. Now, types of glaucoma, there are two types. One is called as the open angle glaucoma. Open angle and narrow angle or closed angle. ठीक है? तो angle हम किसकी बात कर रहे हैं? Iridocorneal angle की. So this is the structure. Here if you see, here we have the, if I draw, this is the cornea here, right? This is the cornea. And here you see this is the trabecular meshwork. You see I've drawn it's not exactly, it's a mesh. So I've drawn a kind of a mesh. You can see जाली जैसी है. And जो aqueous ये lens है यहाँ पे, this is a lens here. And this is the iris, this is the pupil. So I've drawn it here again. I'll make this is the pupil. So here we have the ciliary body in the blue, if you can see here, ciliary body. And this is from where the aqueous humor is produced. Now aqueous humor direction of travel is these green arrows. So it is produced from here. It goes right like this through the pupil, and then it is going to go out through the जाली से ऐसे pass करेगा, and then there is a canal of Schlemm, and then it leaves. ठीक है? So this is how the aqueous humor is produced and drained. So 90% of this aqueous humor gets drained through the trabecular meshwork. Very less amount would drain in this direction. This is the sclera. So this is the uveoscleral outflow. ये कम cases में, mostly 90% is through the trabecular meshwork, just 10% is via the uveoscleral outflow. So अब जो narrow angle और wide angle की बात करते हैं, this is this angle, right? So ये angle की हम बात कर रहे हैं, ठीक है? ये angle wide है, बड़ा है, या ये छोटा narrow है. Wide angle glaucoma में problem क्या होती है? Angle तो ठीक है, but some problem in the trabecular meshwork, ढीला हो जाता है, जैसे जाली में हम गंद फंस गया है, ठीक है? So this aqueous humor drain नहीं कर पा रहा है. So आप देखो कि let's say जैसे छोटा सा बाथरूम है, वहां पे there is a drain, ठीक है? और drain hole है, उसके ऊपर जाली लगती है, ठीक है? अगर पानी, normally पानी आप somebody is having a bath, the water is going to drain through that jali, ठीक है? Through the drain hole, through that jali. You don't leave it open, the hole, and it is going to go down and everything is going to be fine. But let's see, वो जो जाली है drain के ऊपर, that gets blocked. बहुत सारा या ढीली पड़ जाती है, या it is it gets rusted or whatever, for a reason it gets blocked, so that water is not able to now go through that jali. If water is not able to go through that, it is going to accumulate in the washroom only. तो वो बढ़ता जाएगा, पानी का level बढ़ता जाएगा, और ultimately वो it is going to rise, and that's what is going to happen. Similarly, यहाँ पे क्या हो रहा है? अगर ये जाली weak है by some reason, or there is a block in this thing, the trabecular meshwork, so this is not able to go. So the level of aqueous humor is going to become high. ठीक है यहाँ पे, and that is going to press. जब लिक्विड बढ़ता जाएगा, ठीक है, जगह तो इतनी सी है, और बढ़ी जाएगा, इट इज गोइंग टू प्रेशर क्रिएट करेगा आपकी आई में, और आसपास नर्व्स हैं, वो उसको जब प्रेस करेंगे तो बहुत पेन होएगी, इट लीड्स लॉट ऑफ पेन. सो दिस इज एंगल में कोई प्रॉब्लम नहीं है, ये एंगल रास्ता इसके पास है, बट जाली में प्रॉब्लम है. रिमेंबर, सो दैट जाली हैज एन इश्यू. That is called as the open angle glaucoma. So angle doesn't have a problem. The problem is with the trabecular meshwork. The second one is the narrow angle glaucoma. A narrow angle glaucoma means it is actually more genetically, there are the individuals, इनमें genetically जो ये angle है, ये narrow है, ये पतला है, ठीक है? So ये already ये angle, let's say, ये cornea उनका यहाँ से शुरू हुआ और ये पतला सा है. वैसे ही बहुत कम जगह है for the aqueous humor to go. So what happens in them? ये कैसे glaucoma trigger होता है उनमें? कि let's say you have given a drug which is causing mydriasis, ठीक है, which is causing adrenaline like drug, it causes mydriasis. So what happens, or we have all the adrenergic agonists जो mydriatics हैं, basically you're giving them. जब ये mydriasis होता है तो ये जो size है pupil का ये बढ़ जाएगा तो ये जो iris है ये थोड़ा इधर को move करेगा. ऑलरेडी ये हमारा एंगल पतला है, अब ये और इधर को मूव करेगा, सो इट इज गोइंग टू ब्लॉक दिस एंगल, ये रास्ता ब्लॉक हो जाएगा, ठीक है. दिस इज, इफ यू सी, दिस इज द आइरिस, ये एंगल है, ऑलरेडी पतला है एंगल, और नीचे यहाँ पे प्यूपिल है, ठीक है, प्यूपिल का साइज नॉर्मल साइज है. पेशेंट को कोई ड्रग दिया गया, लेट्स से atropine दिया गया, let's say homotropium दिया गया, these are the kinds of drugs which cause like mydriasis, and pupil का साइज बढ़ जाता है तो ये ऊपर को उठ गया, तभी वो नीचे का साइज बढ़ेगा, ये ऊपर को उठ गया. अब ये ऊपर को उठ गया, इसका मतलब ये एंगल आप देखो बंद ही हो गया, अब रास्ता ही नहीं है for the aqueous humor to go. When this rasta has been blocked, the aqueous humor now cannot go. So there is nothing wrong with the trabecular meshwork, but that path is being blocked, ठीक है, that path is no longer there. So again there will be accumulation of the, and it is very quick because यहाँ पे आपने drug दिया, उसका effect आया, and very quickly the pressure will rise and patient is going to be in sudden pain. It becomes an emergency in such cases. So this is called as narrow angle glaucoma. So understand difference is in open angle there is a problem in the trabecular meshwork. Remember the analogy of the jali in your that drain pipe in your washroom. And for narrow angle, it is this angle has been closed. It blocks when you give mydriatics, anything which is going to increase the size of the pupil, which is going to further decrease the already narrow angle. So this is what happens in glaucoma. Now treat कैसे करेंगे? What should be the treatment modality? See, best, if you see here in this diagram, we can target either production. अगर आप production कम कर दो, that is one way. So you decrease the aqueous production. That is one way. Or number two, you increase the outflows. आप चाहे trabecular से बढ़ा दो, चाहे आप uveosacral outflow बढ़ा दो. Anyways, you can increase the outflow. So which are the drugs which are going to do this function? So if we are going to talk about drugs which are going to decrease the aqueous production, so we have drugs like beta blockers, we have drugs like epinephrine or dipivefrins, we have drugs like carbonic anhydrase inhibitors, and we have adrenergics, or we have these you can say adrenergic agonists also. Okay, these are the various drugs: epinephrine, carbonic anhydrase inhibitors, adrenergic agonists, beta blockers. All of them, they can decrease the production. Then the ones which increase the trabecular meshwork, basically what they do is they will cause meiosis. तभी वो बढ़ाएंगे रास्ता यहाँ से by causing meiosis. So drugs which are causing meiosis are going to then widen the angle and increase the outflow. So basically these are drugs like pilocarpine and physostigmine. Then there are drugs which increase the uveosacral outflow also. So in these we have the prostaglandin analogues, right? So these are the important drugs which are the prostaglandin analogues. They can cause the increase in the uveosacral outflow. Then we even have there's a newer drug which I'll be talking about in the open angle glaucoma, which can also increase the movement through the trabecular meshwork. It's a newer drug which is called as netarsudil. Okay, it's a Rho kinase inhibitor. Netarsudil is a newer drug. Now let's talk about important points about these drugs. So if we classify them into the drugs to management of open angle glaucoma and closed angle, because open angle glaucoma mainly the problem is with the trabecular meshwork. So best way would be you'd find a way to decrease the synthesis. ठीक है, अगर आप ऐसा कर सकते हो कि synthesis को decrease कर सकते हो of the this aqueous tumor, those drugs are going to be the best. So the first one we can talk about beta blockers. Now we can use topically applied beta blockers, like not the systemic ones which have less systemic side effects. Timolol ये beta 1 plus beta 2 दोनों को block करता है. ठीक है. Then we have betaxolol जो सिर्फ beta 1 को block करता है. ठीक है. Then we have levobunol. ठीक है. Cartiolol. So all these are the beta blockers. So basically they are decreasing the production from the beta 2 receptors. So beta 2 जो होते हैं receptors, they increase the production. So if you block them in the ciliary body, they are going to decrease the production. Now timolol is a non-specific you can say beta blocker. So we cannot give them because they have the other effects also. So they are not given in COPDs because they will have their unwanted side effects. COPD वगैरह में नहीं दे सकते. This can be given in COPDs because this is a selective beta blocker. Then levobunol is most long acting out of them. So these are the beta blockers. Number 2 are the prostaglandin analogues. Prostaglandin analogues which we have are latanoprost, bimatoprost and travoprost. ठीक है, ये हमारे पास 3 प्रोस्टाग्लैंडिन एनालॉग्स हैं जो भी प्रोस्टाग्लैंडिन PGF2 अल्फा के एनालॉग्स हैं. So basically they would like to increase the outflow from the view. अगर वहां से नहीं जा रहा तो दूसरे रास्ते से outflow बढ़ा देंगे. So uveo scleral outflow बढ़ाएंगे. So if its trabecular meshwork is not working. Important thing about them is to remember their side effects. So you can remember it by a mnemonic PG edema, prostaglandin edema. ठीक है. P stands for pigmentation. It causes pigmentation of iris. Pigmentation of iris it causes. Then G stands for hair, eyebrows को growth of the eyelashes. So growth of eyelashes. Edema is edema. It causes macular edema. So these are the side effects of prostaglandin analogues. The third group of drugs we have, and remember these prostaglandin analogues are currently the drug of choice. First drug of choice for open angle glaucoma. The third is the alpha agonists, adrenergic agonists or alpha agonists. And because adrenaline as such cannot penetrate very efficiently, it's a poor penetrator in the cornea. So you give a prodrug which is called as dipivefrin. So dipivefrin is a prodrug and it also increases the outflow through the uveoscleral pathway. Uveoscleral outflow increase करता है और alpha 1 से ये decrease करता है production also. ये है because of alpha 2 receptors and this is because of alpha 1 decreases even the aqueous production. So dipivefrin, it's a prodrug of epinephrine. It can better enter into the in the eye into the cornea. The only important side effect of this is that it can cause black pigmentation of the conjunctiva. It can cause black pigmentation of conjunctiva. This is its major side effect. Then the other drugs in this group are brimonidine and apraclonidine. Brimonidine and apraclonidine, they're also used, and brimonidine is basically alpha 2 agonist. Apraclonidine alpha 1 भी है और alpha 2 agonist भी है, right? So brimonidine is not used in children less than 12 years. It has led to depression and all those side effects, so not used in children less than 12 years. And apraclonidine का जो major side effect है, that is lid retraction. ठीक है, apraclonidine retraction, apraclonidine retraction. So उसका थोड़ा सा sounds this way. Then the fourth one is carbonic anhydrase inhibitors. ठीक है, and we have dorzolamide और acetazolamide. So जो कार्बोनिक एनहाइड्रेज इनहिबिटर्स इसलिए ज़रूरी हैं बिकॉज जो दे इनहिबिट द कार्बोनिक एनहाइड्रेज एंजाइम, or that enzyme is responsible, or it is important in production of aqueous humor. So if you block that enzyme, there is decrease in the production of the aqueous humor. So they inhibit the synthesis or the production of the aqueous humor. And the fifth one are the miotics जो हमने बात की, but they are not used as the first line therapy here, which is physostigmine and pilocarpine, because they don't offer much benefit in such cases and they have a lot of side effects. So these are the drugs for open angle glaucoma. Now coming to the closed angle glaucoma, इसमें the drug of choice these days is mannitol. Mannitol is an osmotic diuretic. ठीक है, so by osmosis it is going to pull away the fluid. So this is the drug of choice currently, IV mannitol. दूसरा we can give carbonic anhydrase inhibitors here also because वो production कम करेंगी, that is helpful. Third यहाँ पे ज़्यादा रोल है miotics का, because they will decrease the size of pupil and they will give way to the angle बढ़ा सकते हैं. So यहाँ पे we have pilocarpine का रोल and physostigmine का रोल. ठीक है, but the issue with these drugs actually is that they cause a lot of side effects because they have they cause contraction also the ciliary muscles, they cause brow ache, headache. ठीक है, so they cause a lot of brow stinging sensation है eye में, stinging sensation in the eye, and they even can lead to sometimes corneal edema. So they have a lot of side effects, headache, brow ache, all these kinds. So they're not really preferred now. And the best treatment actually, because ये तो momentary treatment है, ऐसे patients का usually we do surgery. So we create a hole, in the iris, and that eases out their problem. So it is called as iridotomy actually. So hole creation है. इसमें करते हैं तो easily the fluid can go. And the last one I told you, a drug called as nitarsudil. हम use कर सकते हैं in any case because it actually is going to increase the aqueous production through the trabecular meshwork. Not a production, sorry, the flow. ठीक है, meshwork, aqueous flow. It's a newer therapy, Rho kinase inhibitor. Rho kinase inhibitor increases the aqueous production to trabecular meshwork. So these are the important drugs which are used for management of glaucoma. So let's just recapitulate all these things again. If we go to, let's select a lighter color here. Okay, so you know that there can be two types, open angle, closed angle. Open angle is because of problem in the trabecular meshwork, and closed angle would be this angle is very narrow. So the drugs which we can give is either you decrease the aqueous production, beta blockers, epinephrine, carbonic anhydrase inhibitors, and the alpha agonists, or you can increase you can improve the outflow by causing meiosis. Okay, there you give meiotics. Other way, because there are two ways that agar yahan se nahi ja raha trabecular se, so you try and increase the uveoscleral outflow by some of the methods. These are the drugs which are going to act on these particular areas. So open angle mein, the first drug we did was beta blockers. So preferably we select beta blocker which is beta 1 selective, so that it doesn't have the other side effects due to the beta 2 receptors, and it can lead to the problem like it can aggravate asthma and COPD. So it is contraindicated timolol because kuch amount to systemically absorb hoegi. Though it is a locally acting drug, but some amount will be absorbed systemically, and that can lead to side effects in patients who are already asthmatic. So better you give bitoxolol if there is a patient who is asthmatic. So they are going to decrease the production by blocking the beta 2 receptors. Prostaglandin analogues are the drug of choice, latanoprost, bimatoprost, travoprost, and they are going to increase the uveosacral outflow. The only issue with them is, remember, PG edema. So they cause pigmentation of iris, growth of the eyelashes, and edema, macular edema. So that's their side effects. Alpha agonist, the first type is dipivefrin. Alpha 1 पे भी करेगा, alpha 2 पे भी करेगा. It's a pro drug of epinephrine, more lipid soluble. It can easily increase the uveosacral outflow, or it can decrease the production. What you have to be careful about is pigmentation of the conjunctiva. Prostaglandin करते हैं pigmentation of iris. Dipivefrin करता है pigmentation of the conjunctiva. This two important difference. So question अगर आ गया conjunctiva, it is the dipivefrin. Or iris, it is the prostaglandins. Brimonidine, aproclonidine. Again, brimonidine is contraindicated in less than 12 years. It has led to depression and other central nervous system side effects. Aproclonidine leads to lid retraction. Carbonic anhydrase inhibitors are also drugs which inhibit the production of the aqueous humor. And meiotics are the last resort. They are not preferred because they are not of much help in open angle. They would be preferable for the closed angle glaucoma because they decrease the pupillary size and they will increase the outflow. The drug of choice for closed angle is IV mannitol. It's an osmotic diuretic. That means it takes away the fluid with itself by osmosis. So ये fluid और अगर increase in the fluid चाहे body में जहाँ भी है वो osmosis के through जा सकता है. Carbonic anhydrase inhibitors are going to decrease the synthesis of the aqueous humor. Surgery is actually the definitive therapy. मतलब ये तो drugs हैं to just pass time and signs and symptoms करने के लिए, but actually अगर हमें definitive treatment चाहिए, that is surgery. Then this is a newer drug if it is asked, which is a Rho kinase inhibitor, which increases the outflow through the trabecular meshwork. So this is about the drugs used in glaucoma. So we meet again in the next lecture with a new topic. Till then, have a good day. Thank you.